So what you're about to see is one of our training scenarios for the students on combat first aid. The expectation is for them to come in, secure the space, and then begin treating a casualty. They're going to be working through the skills that we've taught them. We expect them to make mistakes, which will be picked up by the staff evaluating and then corrected before their tests and before completion of the course. You're going to see them move through what we call the MARCH sequence, or M-A-R-C-H-E. So this is the sequence we use to address a casualty in a tactical environment. So M for massive bleeds, they'll immediately look for any massive bleeds on the casualty and address interventions such as either wound packing or, more likely in this case, a tourniquet in order to stop that bleed. Once they've confirmed no other massive bleeds, they'll move on to A for airway, where they'll assess the casualty's airway and responsiveness. They'll then move to R, respiration, where they'll check the casualty's main body for any other gunshot wounds, shrapnel wounds, anything like that, using a raking technique in order to find those holes or injuries. They'll then move to send up a ATMIST or report and take a sec to take in the situational awareness, make sure their space is still secure, and breathe, see if there's any other casualties before carrying on with the rest of the MARCH sequence. They'll then move to C, circulation, where they'll check the pulse, as well as doing a long bone and pelvis check to see if there's any other breaks or any instability in the pelvis that may affect the casualty. Once that's complete, they'll move to H, which is head and hypothermia, where they'll apply a space blanket or some other warming intervention so we can head off the issue with hypothermia in the casualty, as well as checking the casualty's head to see if we see any skull abnormalities or indications of injury there. And then once they've completed that, they'll move to eyes and everything else, where they check the responsiveness and handle any other items that may be going on with the casualty. The main goal of the MARCH sequence is to apply those life-saving interventions first, get that bleeding or the respiration under control, and then move to get the casualty out and to higher medical care as soon as possible.